So hello all, and hearty good afternoon to all of you. I am Manan Gupta, and on behalf of Ataxia Awareness Society, I welcome you all to this seminar, and it is a quite complete honor for me to stand before you as we take another step in this journey of raising awareness and towards its welfare. Ataxia may be complex, but within its challenges lies the seeds of resilience, determination, and hope. And complexity is no match for us here, and our collective determination to understand, support, and uplift. Ours, which translates to hope, stands with the mission to not just raise awareness, but to also foster a sense of unity and support. Together, we can shatter the barriers of misunderstandings and offer those help who often feel isolated in this struggle. As we delve into today's discussion, I encourage you all to actively participate in this discussion, ask questions, and make this a platform for open dialogue. In the next few moments, I will take you on an enlightening journey, one that reflects the trajectory of our organization, a journey of passion, purpose, and profound impact. PAAS, Ataxia Awareness Society, was founded in 2018, and the inauguration was graced by Dr. Achal Srivastav, Professor of Neurology, AIMS, and Padma Shri Janak Palta. From then, PAAS took flight and conducted many speech therapy and physiotherapy camps, both physically and virtually. We have also organized several for blood donation connection and blood sample collection for DNA tests to diagnose the type of ataxia, which is very essential to know for any kind of treatment. PAAS has also donated walking aids and wheelchairs to ataxia patients. 2020, the pandemic was upon us, yet PAAS persisted and continued its support, hosting numerous webinars on various topics to support patients. Domains such as income tax rebates and other government privileges, dietary awareness, fostering mental and emotional strength, and occupational therapy, and many more. Cometh 2022, PAAS held a two-day National Ataxia Summit. Patients from across the country gathered in Indore, where accommodations were provided at Akshat Garden. The event included extensive physiotherapy checkups with doctors from Terna Physiotherapy College who traveled from Mumbai. A panel discussion was organized featuring doctors from AIMS and abroad. Additionally, motivational talks and entertainment sessions were also provided. At present, PAAS holds daily speech therapy sessions under guidance of Dr. Hemina Deva, and the sessions are generally conducted by Mr. Vivek Rao, present with us today. Please give a big round of applause for such a beautiful initiative. He is an ataxia patient himself, and he conducts the webinar by himself. Okay, now I am honored to invite an ataxia patient herself and the inspiration behind PAAS. Please welcome the founder and president of PAAS, Ms. Swasti Wagh. Swasti, can you please open your video and mic also?
नमस्कार, मी स्वस्ती. आज तर्फे मी इथेच उपस्थित सर्वांचं मनपूर्वक स्वागत करते. Today we have gathered here to know more about a rare neuromuscular degenerative condition called ataxia. Ataxia is incurable till now, and also it is progressive. So it makes it very difficult to manage in course of time. Patient becomes totally wheelchair bound and dependent on others for their day-to-day activities. Only practice of regular physiotherapy and speech therapy exercises can slow down the rate of progression of disease. Furthermore, ataxia patients are mentally sound and are well educated, but this disease makes them unfit everywhere. Ataxia is of different types, of which many are genetic. This means a family can have two or more ataxia patients. Imagine what a difficult situation for family, and therefore it is very necessary to control passing of this disease from generation to generation. In this, proper knowledge of genetics of ataxia and genetic counseling can help a lot. So I think it is very important to spread awareness about ataxia in society and as well as among ataxia warriors. I hope this seminar turns out to be a step towards the welfare of ataxia warriors and helpful in promoting research, especially genetic research, to find cure of ataxia. Thank you once again. Manan, you can continue now.
Continuing forward. Uh, Now I'm honored to introduce Dr. Nasli R. Ichaporia with us. He's a director of neurology at Sayadri Hospital. Dr. Ichaporia, a graduate of BJMC Pune and Neemans Bangalore, is a pioneer in stroke thrombolysis. He has established two stroke units, one neuro ICU in our city, and is a preceptor for stroke thrombolysis in South Asia. His contributions extend to running a stroke fellowship program and leading many constitutional stroke trials. Beyond his professional accolades, he is an honorary Rotarian recognized by TOI and has served as past president of MAN and NSP. Please join me in welcoming Dr. Naslia Chapore. I would request Mansi to please welcome, sorry, Mami Apari.
Yeah. First of all, thank you for the very kind invitation. Uh, and I'm really very glad to be here and to speak to so many people on this topic. Now, yeah. Ataxia in Greek means lack of order. And ataxia is a syndrome of imbalance in coordination involving gait, limbs, speech, and results in disorder of the cerebellum or its connections. So, I will explain it to you as we go along, but just remember these words. It involves gait, it involves limb, it involves speech, and it is a disorder of the cerebellum and its connections. And it is characterized by dyssynergia, dysmetria, and dysdiadochokinesis. Now, what do these words mean? Dyssynergia means the synergistic action is lost. That means, suppose you have to pick up something, your triceps here has to contract, and your biceps also has to contract, and it has to slow down the movement and reach the target. Now, this cannot be done if the cerebellum is affected. It overshoots or it undershoots. So it becomes dyssynergistic. And this is the same as dysmetria. And dysdiadochokinesis means you cannot do alternative movements. Like, say, for instance, like this. Quickly, you can't do it because your cerebellum is not working. And as Gordon Holmes said, it is a disorder of rate, range, direction, and force of movement. Now, it's a little difficult for you to understand this, but I will try as we go along. Now, everyone talks, say, ataxia. I think the emphasis of this meeting is the genetic forms of ataxia, but there are many ataxias. Ataxia is everything. So there is sensory ataxia. What does it mean? Sensory ataxia is when sensations do not travel into the body and go into the brain. So because the sensation is not there, you don't know where your leg is. You don't know where your knee is. You don't know where your hip is. So you cannot walk and you lose balance. You have to keep your eyes open. See, you cannot walk with your eyes closed. Close your eyes, a person with sensory ataxia will fall down. So that is sensory ataxia, very common, very common. And this is because of peripheral neuropathy, when the sensations are not going, diabetes being the commonest, and other disorders of the spinal cord, which we will come to as we go along. And so this is a very important form of ataxia. So this is sensory ataxia. Then there is a vestibular ataxia. That means your balancing mechanism in the inner ear is disturbed. So people say, chakkar yati, chakkar. Now, you cannot understand. When they say chakkar, what does it mean by chakkar? Chakkar means loss of balance, or it means rotation in space, or it means the inability to walk. So you must ask the patient, chakkar manje kai? So, people say, even if person falls down, they'll say chakkar ali. Even if he gets a fit, chakkar ali. So you must clarify. As a physician and as a person, you must clarify, what do you mean by chakkar? So when things rotate round, or the person feels that he's rotating around, that is called vestibular ataxia, and it is usually associated with nausea and vomiting. It can be very severe. It's highly disabling for some people, and life becomes miserable. It's like, you're in a ship all the time. You're going like that. So you can't walk, or, the things are rotating. It's a terrible feeling. And people, they hold your hand when they have vestibular ataxia and say, padnar, they think they're falling off the bed. So this is vestibular ataxia. And not cerebral mistake. Cerebellar ataxia is when there is a disorder of the cerebellum. And here it can affect body, balance, gait, and movement. So we'll come to that as we go along. So 3 important types of ataxia, which you must realize are important, and you need to clarify. Patients tell you that balance aata hai, but ka aata hai balance. That is your role to find out why the balance is going. And unless you find that out, how are you going to treat? You cannot treat blind. So you have to make a proper diagnosis. Once you make a proper diagnosis, you can go ahead. So look at this cerebellum. It's amazing, you know. When I was reading again about this, I've always been fascinated by the cerebellum, but it is at the back of the brain, at the back of the brain. And what it means is Ataxia, lahan mendu, small brain. Lahan mendu. Lahan mendu. So lahan mendu has many parts. It's many parts. We will come to that. See, where's the pointer? Yep. Pointer, can you see? This is the central part of the cerebellum. It's called the vermis. And this is the anterior lobe of the cerebellum. All these are very important. Then there's posterior lobe, and there is this floccular nodular lobe. So just try to remember these. These are very important. Yeah. Now, floccular nodular lobe, which is at the back, and very small part, this green part, this is connected with the vestibular system. And this is concerned with balance. This is concerned with balance. The other part, anterior part of the cerebellum, here, this violet part, is the anterior part of the cerebellum, also called the paleocerebellum. We'll tell you what these are. And this blue part is the neocerebellum. So, it's very interesting. Yeah. So this is how the cerebellum looks on the MRI. It is at the back of the brain. Sorry, there's no pointer, so I'll have to be here. Okay. So this is at the back of the brain. This is the brain on top. This is the cross section, sagittal section of the this thing. This is the brain stem. This is the cerebellum at the back. And if you take sections like that, it looks like this, nice and full it looks. See how nice and full it looks? Okay, so this is how the cerebellum is. It's at the back. And it is folded. It is like the leaves. You take leaves of a paper book, of a book, and you put one leaf on top of the other. It is folded. So this is, therefore, it is called folia. Now I'll tell you later on what is the meaning of folia. So it is folded on each other. So that is called folia. So these are the folia of the cerebellum. If you see these things here, these are the folia of the cerebellum. They are folded one on top of the other. Now, if you see, it's very interesting. Fish. If you have a fish, what does the fish need? It needs to balance. It doesn't have hands and legs. So it needs to balance. So it needs the old part of the cerebellum, only for balance. If you've seen a fish, no, when it's not well, it goes like that. Uska cerebellum gaya. That is the paleocerebellum, old cerebellum. Okay, old cerebellum. Then you come to the frog. What does the frog need? Frog needs to hold balance. What does the dog need? Dog, cat, horse. It needs to maintain balance. That is the old cerebellum. That is the archicerebellum. It needs posture. It needs to stand properly. It needs to coordinate all the four legs together. Okay? If that doesn't work, the horse will go like that, or the cat will go like that. You see, some cats walking like that. So that is the paleocerebellum. Then the monkey came. What did the monkey need? It needed to grasp objects. It needed to catch the fruit from the tree, or to fight with somebody. So it needed the neocerebellum. So it needed proper coordination. It had to hit the target. Otherwise, if you go like that, as I told you, dyssynergia, it wouldn't be able to go to the target. So it would go like that. So that is the neocerebellum. So this, through evolution, the cerebellum has grown. So each part of the cerebellum you require. You require for balance, you need the paleocerebellum. You require for posture and gait, you need the paleo-cerebellum. And to do fine movements and to do alternative movements, you need the neocerebellum. Okay? So the big part of the cerebellum in human beings, big part, because we have to do fine things. We have to do surgery. We have to put a thread into a needle hole. Okay? We have to eat properly. Okay? Dog doesn't need to pick up the food and eat. It puts its head there. But we need to pick up the food and eat. If you can't do that, it will go like this. It will hit here, hit here. This is the neocerebellum. So these are disorders of the neocerebellum. So understood? So most of our patients, they feel that their neocerebellum is gone. But also, if the neocerebellum is gone, even the paleocerebellum and archicerebellum is gone. Okay? Now, there are some diseases which involve only certain part of the cerebellum. Say alcohol. So alcoholic damage to the brain, to the cerebellum, is only for balance. So those alcoholic people, they cannot walk. If you take a lot of alcohol, whole cerebellum goes. Jada liya na, 5 peg. Very common. काय झालं? गटर मध्ये पडला. का पडला? Because he could not balance. So the cerebellum, so the alcohol has attacked the cerebellum. Okay. It has attacked neocerebellum, paleocerebellum, everything, pan-cerebellum. Okay. But there are certain things which affect only certain part. We will tell you as we go along. So you understood this concept. I find this very interesting, you know, how evolution has occurred, how it occurred in fish, how it occurred in four-legged animals, how it occurred in primates like us, you know, to use hands. So this is all how the cerebellum has occurred. And the cerebellum, because it has to do so many things, it holds 80% of all the brain neurons. 80%. Itna sala chota hai. Rest of the cerebrum is quite big. Cerebellum is so small, 1/6 the size, but it has 80% because the cells are very small. They are called molecular cells or granular cells. So very small cells, but large number of cells, and they are folded on top of each other like leaves. They're called folia. So now, as I told you already, you need vestibular. You need to know where your head is in space. That's a chakkar yanar. Suppose you go in a merry-go-round, your vestibular system goes. So you can't walk. Can you walk? So you merry-go-round mein gaye na 50 time fast. So your vestibular apparatus is gone. It becomes immobile and it doesn't put inputs into the cerebellum. So that is vestibular cerebellar connection. So the vestibule is connected to the cerebellum. So that is the old part of the cerebellum, like a fish. So that is the archicerebellum. Okay. Then cerebellum also receives input from the eyes. So without looking, patients with cerebellar ataxia or sensory ataxia, they cannot walk or they cannot balance. So you need input from the eyes. And you need input proprioceptive. You need input from the hands. You should know where your hand is, you know. Otherwise, how will you pick up this rubber band? You have to know now where the hand is, where your shoulder is. You have to control it. Exact, you have to go there. If that input is not there to the cerebellum, it cannot understand only what is happening. Okay? So the cerebellum is connected to the brainstem. It is connected to the brain. And now we feel it is also connected with emotion. And recent studies have shown that if you think of doing a movement, like picking up something, actual impulse comes from the cerebellum, goes into the cortex, and then comes down the pyramidal tract, and you can do that action. So it may be an initiator of movement. So it is concerned with movement, it is concerned with balance, it is concerned, and now we feel it's also concerned with emotion. So, you know, previously we never thought that, we thought emotion, First, so they thought emotion came from the heart. It came from the heart. But now it's from the heart, it's gone to the brain. So we thought emotion comes from the hypothalamus and hippocampus and frontal lobe. But now we know that maybe it comes from the cerebellum also. So if you fall in love with a girl and she says no, brain effect of the baba, heart to kuch nahi hota. So the cerebellum gets affected. First she says no, but after some time she'll say yes. Don't worry. Okay, so this is the role of the cerebellum. Very interesting. You need to understand this very carefully. Now, I don't think I'll go into this, but the cerebellar gate here in the middle, cerebellar gate is a broad-based gate. So, because you cannot maintain balance with your feet together or on one leg, you have to have a broad base. So, like a sailor who walks on the ship, or PMT bus, if you go, no, you have to walk like this, no? So you cannot walk like this. So cerebellar is like that. So that PMT bus driver, no, he destroys the cerebellum. Or the sailor, sailor in the boat like that. That also your cerebellum goes for a toss because your vestibular system is not able to manage that. So cerebellar gate. Then the sensory gate, sensory ataxia, last one, is you can't feel the ground. There's no sensation in diabetics. Very common, diabetics. I'll talk to you about that. They can't feel the ground. So you can't feel the ground. You can't feel your shoe. So you're banging your feet. So high stepping gait. So you get a gait like that in sensory ataxia. Okay? Right. So in cerebella, to maintain balance, the child, this is a child, but it can occur in an adult, you have to have a broad-based gait, and you have to walk like that. Later on, you may have falls because of this, so you may need a stick, or later on a wheelchair, as the cerebellum becomes more and more damaged. And then this dysmetria, which I told you, okay, you have to go to the exact point. Suppose there's an apple there, and you have to pick that apple. What's the pointer? Great. Yeah. You have to pick this apple here. So you have to go there, no exact. Either udhar jayenge to kaisa milega. Okay. So in dysmetria, the hand goes like that because it cannot control the movement. And this is neocerebellum. Again, neocerebellum. So gait is with cerebellum. Huh? Ab so gaye kya? Post lunch. Okay. Gait is paleo old cerebellum. Getting the exact movement is neocerebellum. Okay. So neocerebellum. And sensory ataxia, I told you, high steppage gait. Like those horses, no? In Asia, you saw that dressage, how those horses, as if they are dancing. So it's like that, dressage. Okay. So what happens? First of all, there's lack of coordination. Eye movement abnormalities. Why eye movement? Because the vestibular system is connected to the cerebellum. So the archicerebellum. So your eye also, it cannot focus on one object. It keeps on shaking like that. That is called nystagmus. And because it is shaking, it cannot focus on that particular object. And therefore, patients say that it barabar disat nahi. But it's nothing to do with the eye. It is to do with the continuous eye movement, which is called nystagmus. And the shaking of the object is called oscillopsia. That means the image is shaking because it is moving in the retina. It is not fixed in one part of the retina, in the macula. It is going from side to side, and therefore you cannot focus properly. Then slurred speech. What do you mean by slurred speech? You ask the patient, bola satara cha matara. So you say sa-ta-ra, sa-ma-ta-ra. This is slurred speech or staccato speech. Or you say Pune University. Pune University. The Pune University. British Constitution. British Constitution. This is the speech. Because speech also cannot be controlled properly. And this is called staccato or scanning speech. Staccato is like a machine gun. Machine gun. That is staccato. Okay, like a machine gun. And scanning means slowing. That is scanning. Okay, scanning and staccato speech. Then tremor. What type of tremor? They have intentional tremor. You know, if the hand is just like that on their lap, there is no tremor. But when they try to reach an object, because they cannot go to the target properly, there is intention tremor. Intention tremor. Or he takes a teacup and as it comes closer to the target, it shakes more. So that is intention tremor. Okay, that is typical of neocerebellar affection, and that is called intention tremor. Difficulty in walking and poor balance. This is because of involvement of the paliocerebellum and the archicerebellum. Gait abnormality, same thing. Deterioration of fine motor skills. Heart problem, I'm wondering how this heart problem comes. But I told you, no, that emotions are also involved. So it's a heart problem. Trouble eating and swallowing and lack of coordination. So these are all the symptoms of cerebellar ataxia. Now, sensory ataxia. Some are hereditary, but what we find commonly in our country, as I told you, diabetes common. Diabetes common. Alcohol consumption if your sensory nerves are gone. Nutritional and vitamin deficiencies. Now in India, according to me, now, everyone is B12 deficient. Everyone. Vegetarian, kuch bhi nahi. Everyone is B12 deficient, and if the B12, you'll be surprised. Normal B12 level is say 200. You surprise patients 40, 30, 20. ऐसे आते, and they are ataxic, sensory ataxia, because their posterior columns are involved. So B12 deficiency, very common. B12 is found in no vegetable. No vegetable has B12. Milk has little bit, but if you pasteurize the milk, वो भी जाता है. And that poor cow also, you don't feed it properly. Usme bhi B12 kaisa आएगा? Cow is also half fed, half hungry. So therefore, it's very common. Okay, so people say, "मैंने मी खातो non-veg." किती खाता? मेहनत नहीं एकदा. उससे थोड़ी B12 मिलने वाला है. So everyone should, according to me, take B12. And best way to take it is on your birthday and wedding anniversary and your partner's wedding birthday. Take an injection of B12. That is a vaccine for good health. Don't quote me, but what I'm saying is correct. Multiple sclerosis, another common one. When we were students, our teacher said, hey, why is he studying multiple sclerosis? Multiple sclerosis is not there in India. Forget it. Don't read that chapter. Now, every week, 2-3 new cases. And who? Young girls. And who? Which young girls? Prettier the young girl, more likely that she will have multiple sclerosis. I don't know how, but it's true. It's true. Now, you think I'm joking? Do Google and see. Is there. And then there are some other toxins and all. Another common thing in nutrition, after bariatric surgery. So many fat people are there. So many fat people. They do bariatric surgery. तो डॉक्टर बोलता है मस्त किया सर्जरी, आज तक कभी लाइफ में किया नहीं मैंने. अरे but that doctor forgot to give him vitamins yaar, and he got vitamin deficiency because his stomach only is not there. So many cases of post bariatric surgery vitamin deficiency producing sensory ataxia. Very important. This is coming up new now, because previously we never did bariatric surgery. Now people want to, have slim bodies and all that stuff, looking at all those actresses. So it's coming up. So this is something you should not forget. Yeah. Now this is a patient we had multiple B12 deficiency. Her B12 level was 50. 50. It should be 200. And you see the spinal cord here. This is normal spinal cord. Here, this white thing is there at the back. And if you do cross section, you see this thing at the back. Her posterior columns are damaged due to B12 deficiency. So this is B12 deficiency producing sensory ataxia. Right. Now we come to the cerebellar ataxia. So cerebellar ataxia, so many causes. Cerebellum is very sensitive. Very sensitive. So, everyone just is interested in these genetic and hereditary, chronic, slowly progressive, this thing. We'll talk a little bit about that. But if you get a stroke, you can get cerebellar ataxia. If you have a tumor in the cerebellum, you can have a cerebellar ataxia. If you get infection, which infection? Chickenpox. Very common after chickenpox in young children. Infective or para-infection, acute cerebellitis, inflammatory. Or, previously we used to see people with ear infection. And that ear infection, because the cerebellum is just ear, from the ear it used to go infection and it used to form pus in the cerebellum. We now don't see so many cases because of good ENT control. But yes, from the ear it can go. If there's an injury here, it can go. If you have deficiency of B12, B1, E, A, toxins or drug induced, so common. Some people, I had one patient, they were taking that flagell, काय ते पोट साफ करण्यासाठी, पोट साफ. अरे flagell ले रहा है, 2 साल से ले रहा है, as if he's got amoeba. He doesn't have any amoeba, but he feels that, पोट साफ करण्यासाठी. He's taking flagell day after day. That flagell is gone and stuck in his cerebellum. So toxins, drugs, alcohol, as I told you, many other drugs are there. So many things can affect the cerebellum, and these are all acute. And once you treat them or you remove the toxin, patient improves. And of course, you have to do rehabilitation and physiotherapy. And then we come to the genetic and hereditary causes. These are autosomal dominant cerebellar ataxia. These are called spinocerebellar ataxia, SCA, and they have various numbers. 1, 2, 3, and each has certain characteristics. But in India, what we have found is cerebellar ataxia type 3 is the commonest. Type 2 is also there, but type 3 is the commonest. And surprisingly, once one friend of mine, he said in Buldana, there are many patients of this cerebellar ataxia. So you come to Buldana and we will see all those patients. So we went there, I and some friends of mine, doctors, and we saw about 120 patients of cerebellar ataxia. So we took their blood. We couldn't examine that blood in India. So we took their blood and sent it abroad. And it came out that they had spinocerebellar ataxia type 3. Now, this is called Joseph Machado disease. Joseph Machado disease. And it is found in Portugal. How the hell did it come here to Buldana? So maybe some Portuguese sailor came to Goa or Daman or Diu or wherever, and some fellow from Buldana went there and got that gene and passed it on. We don't know how it came. But this particular gene, Joseph Machado, is found in Portuguese, and somehow that gene has come to Buldana, and 100 patients we saw, 100 in one day, from morning to evening we are seeing patients. So these are cerebellar. So where that gene has come from, we don't know, but there are many such genes which are there producing this cerebral this thing. I'm exceeding the time. Then there is a recessive form, episodic form. Yeah, now this is all little complicated, you know. It's difficult for us also to diagnose all these. But this is the list of degenerative or hereditary or chronic, slowly progressive cerebellar ataxias. Now, MRI is a wonderful tool to diagnose cerebellar disorder. And here you see this whole cerebellum has become white. Whole cerebellum has become white. And this is because of typhoid. Typhoid. You know, typhoid not treated properly, that Salmonella bacteria have gone there and stuck there. And this is infective cause. I told you chicken pox is one. When I was a student in Sassoon in 1980, I had written a thesis on cerebellar ataxia in enteric fever, that is typhoid fever. That was my dissertation. But that time we never had MRI. So now this MRI has shown that yes, what we had said that time 40 years ago, 50 years ago, is 40 years ago, is correct, and cerebellar ataxia due to typhoid. Then you can get a stroke like this. This is a stroke. The blood vessel gets blocked because of various reasons. And common reason, this particular case, you know what the reason was? Amazing. One young girl, she went to the beauty parlor and she put her head back like that to wash her hair, to shampoo her hair. And this vertebral artery got chinked and it got blocked and it produced an infarct. So this is called wash basin cerebellar ataxia. Wash basin, saloon, something. Barber chair cerebellar ataxia. This one. This particular case, this one. So don't let anyone touch your neck. No massaging the neck. Tip, barber tip, man todtat na. Man todaichi nai. Nobody should touch your neck. No boyfriend, girlfriend, husband, wife. Nobody should touch your neck or massage your neck. Be careful, Baba. मेरे को तो बहुत डर लगता है. You know, when I was young, no, I always used to wear a tie. When I heard this, no, I stopped wearing a tie. Yeah, it's a tie pin. It's too tight. It will damage your vessel. Now, this is another infarct. This is called Wallenberg syndrome. And this is not in the cerebellum, but it is the connection of the cerebellum. So this involves the floccular nodular rope, the archicerebellum. Okay, and this also produces severe ataxia. And this is a hemorrhage, bleeding inside the cerebellum. This can produce death, you know, if it increases. So we have to do urgent surgery and remove this clot. And as I told you, multiple sclerosis, common disease in India now, common. Okay, everyone used to say, "Nai, India mein nai," but it's there. Many patients, many patients. And then this is the cerebellar atrophy and degeneration. What I told you, this folia, now you can see the folia. Previously, you saw that picture. It was nice, full cerebellum. You could not see the folia. Now you can count the folia. If you can count more than 3, it is cerebellar degeneration. Now count here. 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 folia you can see. So this is degeneration of the cerebellum. Cerebellum has become small, and you see how small it has become here. Previously it was nice and full. Now it has become small, and this fourth ventricle has become big because that space has gone away. And then there are various treatments for cerebellar ataxia. And you know, now people say that it is untreatable. You can't do anything. You can't do everything. but you can do something. You cannot do nothing. You can do something. You can make life better for people. It's not curable. Okay, it's not curable, but you can make life better for these people. And these are the various. So you have to make. Therefore, you have to make a proper diagnosis. And each of these things. Now, I can't go into all of these. How you should treat each of them, but important to make these diagnoses so that you can give the proper treatment. And some people also you can give symptomatic treatment. Suppose you have low blood pressure, you can give medicine. If you have bladder problem, you can do something. If you have Parkinsonian features, you can. If you have drooling of saliva, you can give some medicine. If you have swallowing difficulty, you can do something. So something you can do. It's not that you cannot do anything. This thing is wrong, and therefore, as rehabilitation people, physiotherapists and all, you have a big role to play. And I said, though there is no medicine, there may not be a medicine for the degenerative conditions. There is a lot you can do to make life better for these people. And it's very important for us to talk to them, to listen to them. The more you talk to your patient, the better it is, the better response he gives you, the better feel he gives you, and he also feels much better. So treat these patients well. Don't say that kai nai karu shakat. Nai, that is wrong. Sorry, I've over-exceeded my time. And this is the physiotherapy you could do. And thank you.